I am here at South Shore IV Clinic, which is to do with the antibiotic which I'm receiving in my arm, which I burnt my left foot under my little toe, and it turned into an ulcer, which resulted in me getting osteomyelitis, which is a bone infection. And I've been coming and having this, it's called a midline. I've been having this for around about 8 weeks now. The good news is that it's cleared. My blood results are very positive. They tell me there's no markers for the infection, which is good news. So it's just a matter of the whole healing up. I come every day, around about 11. I'm here for roughly an hour to an hour and a half, and it's such a lovely little unit in South Shore. We meet some lovely people, and the staff are absolutely brilliant. They make me so relaxed, and we have such fun. You wouldn't think I was coming for medication that's so, for a serious condition. And they inspire confidence in you, especially if you may be worried about having a needle put into you. And they're so gentle as well, that's the thing. And you get to know the staff, and instead of coming to nurses, it's like friends. I know a nurse is a nurse, but it's not. It's more than that. It's the absolute care that they take to look after you. And also, if you've any problems, they'll try and explain everything to you. This times you would think this was a bit of a social club, really, because everybody's so happy, everybody's smiling. I haven't seen a miserable face yet, especially with me around. But no, everybody's so wonderful. I have a nice friend who I've met, who we've grown up in the same area. There's slight age difference, but we could have met when we was children, and we just met through this clinic. And it's so wonderful that we talked about parts of my side in Manchester where we were brought up, and he lived at the back, and I lived in the front of him, basically. And that very nice gentleman is here this morning.
Hi, my name's Alfred. I'm here today as part of a treatment for an infection I got in my knee. It's an IV treatment, which means they give me antibiotics through my arm directly into me. From my perspective, apart from meeting John, he was a great guy, it was an alternative to either stop in hospital for another 10 weeks maybe and have the antibiotics, or come to this facility which I'd never heard of. It's a bit of trepidation when I come down the first day, but I thought it's got to be better than being in hospital, because I'm at home now, seeing my wife and my dog. And so when I was sat outside in the reception, what I did see was a massive big wall of all cards, people saying thank you and how glad they was for the service they got and everything like that. So that impressed me, that made me feel a little bit better. So then I came in and I seen all these happy smiling faces, all in a similar situation for me, but a different part of the body. I thought, well, she can't be that bad. And anyway, the first day it was great. The nurses are absolutely fantastic. They're so professional. And just to watch them do the job, all with a smile on their face, they never seem to bicker. They're just doing it. They know exactly what they're doing. It makes you feel very, very comfortable. So I was great then, and I've been here 2 weeks now, and I feel great. Yeah. It's great. It's doing the job. Everything's going according to plan. The place is absolutely fantastic, but nobody knows about it as far as I'm concerned. I didn't know about it.
It's great to get feedback from John and Alf. We always use our feedback to try and improve the service, and it's fantastic to receive that positive feedback from them. So thank you very much. We've got 10 nurses in total in our team. We also work closely with pharmacy and microbiology at the hospital, and we do home visits as well as having a clinic here. So it's really great for the patients to come and meet all the staff, and everyone gets on so well. Such a lovely service.
I think they're a fantastic, we are a fantastic service. We deliver to the whole of the Fylde Coast, and people meet in the clinic and they become part of our social family while they're here. and to give them a good experience, which is much nicer than being sat in the hospital for so many weeks that the treatment may need. It's much nicer for them to come here and have a bit of fun and laughter whilst they get the treatment. They don't even know that they've had it by the time they've finished. So it cuts the anxiety for them as well.
We do get an awful lot of positive feedback from the patients. They do love coming, and it's a bit like a social group here, so it's fantastic for them.